wrist fractures are a very common injury for the hand and wrist and elbow surgeon. I see wrist fractures almost daily. Most common reason for a wrist fracture is falling on the wrist. It could be high energy injury, like falling from a ladder, or just simply a ground level fall. The treatment is based on the severity of the injury. If a bone is in good alignment, then we will treat it with a cast, a brace, and physical therapy. If the bone is shattered, meaning it's in multiple pieces, if it's displaced, the pieces are out of alignment, then we typically fix it with a plate and screws. With advances in modern plating techniques, we now have what's called locking plate technology that allows us to fixate these fractures. And it's particularly useful for treatment of patients who have osteoporotic bone, elderly patients who have thinner bone, and the plate and screws get better purchase than non-locking plate and screws and allow us to fixate these bones. So what locking technology is, so this is an actual plate that would go into a patient's wrist. If they broke their wrist, the plate would go in this direction, and it goes inside, and it goes inside the wrist, and these screws, they go in through the plate and they capture the different bone fragments. The screws lock into the plate and they prevent the pieces from pulling out, and the plate holds the bone pieces in place while they heal. So this surgery is typically done outpatient. We have the patients immobilized for about 2 weeks in a permanent splint, and then in a removable brace for another 6 weeks. Physical therapy is needed to regain function, and I tell my patients we're typically looking at a 3 to 6 month recovery. Of course, our preference is to treat fractures without surgery, but when fractures are severe enough and the bone is displaced enough, then we typically fix it with surgery. Once the bone is healed, the goal for these patients is to allow them to get back to normal use. So after a 3 to 6 months time frame, once the patient has finished therapy, fully healed, we let them get back to normal use, no restrictions.